Smart health insurance for smart investors. This is Health Insurance 101 for self-employed folks. We're going to cut costs, but we're not going to cut coverage. I'm presented by me, Rick Thornton, and this is for businesses with fewer than 10 employees under 65 years of age. So why are you here? All right. You want to understand your health insurance options. You want to avoid costly mistakes when purchasing health insurance. And you want to learn how to evaluate and choose the right plan. And that's what I'm going to do. I'm going to teach you all those things. Let me tell you a little bit about myself. I'm Rick Thornton. I'm a mechanical engineer with an MBA from Carnegie Mellon. I've been in the health insurance field for quite some time. I was diagnosed with cancer, and I saw a lot of flaws in the system. As a result, I became an agent, and I founded Insurance for Dallas in 2002 to fix a lot of those issues. I have over 25 years experience in the industry. Now, I know that says 22, and right now, 2002, and right now it's 2025. That's 23 years, but I've had some other experiences in the 80s also. The real problem. Here's the real problem with health insurance. Premiums and deductibles are only symptoms. The root cause is non-transparent healthcare pricing. True affordability comes from understanding where your costs come from. And that's what I'm going to show you. I'm going to show you where your cost comes from, and I'm going to show you how to mitigate that cost. The three pricing tiers are: you have your sticker price. That's when you go in and you don't know any better and you just have a procedure done on you. They charge you the highest price you can get. It's like going to buy a car and no negotiations whatsoever. The other one is the PPO allowable price. That's the predictable price. That's already been negotiated. When you have your PPO with a specific company, you already know what that price is going to be because it's written in the PPO. Now, sometimes the person at the desk may not know what that price is simply because every PPO has a different negotiated price with that particular insurance company. And then we've got the cash price, which is usually the lowest price. Transparent tools. Now, transplant tools work well with indemnity plans. And we're going to get into some indemnity plans also, but let me go over that just a little bit. We've got something called National Consumers Benefit Associations. Now, I was there last week. I was at the meeting they had in Boca Raton last week to go over some of their benefits. And one of the things they have is Healthcare Blue Book. Healthcare Blue Book lets you know what's customary, usual, and reasonable as far as cost is concerned. Then there's MD Save, which does some of the same things that Healthcare Blue Book does, but it also has places where you can find doctors who do certain procedures over the volume of procedures they may actually do. And then we have Health Assist. Now, Health Assist has many parts and they're constantly growing. They have colonoscopy assist, they have lab assist, they have radiology assist, and I'm going to show you some examples in a minute on how that can help you save on cost. And last but not least, we've got for drugs, we've got GoodRx. GoodRx uses its own PBM. That's how it's able to get costs so much lower. And it also creates coupons that it works out on volume in order to get you some of the drugs that you need. So these are some of the ways you can learn how to be transparent, how to reduce your costs. So here's some of the hidden costs to watch for. RX tiers, brand versus generic. You can always get a better price with a generic brand than you can with a brand name drug. Facility fees. There are three types of hospitals. There's state hospitals, which are the least expensive, non-profit hospitals, which are about in the middle, and then there are for-profit hospitals, which are most expensive. So knowing what hospital you're going to could make a big difference in your cost. Balanced billing. What is balanced billing? Balanced billing is when you're out of network usually and you don't know it. As an example, you go in for a procedure, say to have a colonoscopy. And in that colonoscopy, you've got the facility, you've got the surgeon, you've got the assistant surgeon, and you have the pathologist who's in network. The only person not in network is the anesthesiologist But you don't know they're not in network because the others are in network, so you make the assumption everybody in the room is in network. I've actually been in a room getting ready right before procedure, and I asked everybody, are you in network A? Are you in network A? And I wanted to make sure everybody was in network A so I could get the best possible price. It's kind of late to do that, but that's what I did. So if the anesthesiologist is not in the network, that anesthesiologist can pretty much charge anything he wants to charge. So it may not be something that's customary, usual, and reasonable. So you need to watch that. Make sure everybody's in network before you have that procedure. Let's break down the real costs. Premium, monthly cost. Okay, so that's what you're going to pay every month. There's a way you can reduce that. Deductible, what you pay before insurance. Okay, so before the insurance it kicks in, a lot of times you have to pay your deductible. There are some ways you can reduce that also. Co-insurance, shared cost after deductible. That's like your 80. That's when you go into the 80-20 aspects of your plan. And then there's your out-of-pocket maximum. That's the maximum amount of money that you'll be spending on your per year on your health insurance. So as an example, if you've already spent, say, $10,000 and that's your out-of-pocket maximum, if your bill goes up to $10 million, that's the most amount of money you're going to spend, which, of course, includes your deductible. Now, here's some alternative cost-sharing strategies. Association and group coverage. Now, I don't do a lot of associations, and those in some states they're good, in other states they're not. I haven't seen an association plan that stood out. I have seen some group coverage that works pretty well, and these groups are targeted to individuals. Hospital indemnity plans. Hospital indemnity plans were designed to cut costs. Most people don't realize this, but Medicare is a hospital indemnity plan. Health insurance marketplace. Now, a lot of people don't like these plans, but hey, listen, if you're getting a subsidy, that may be the way to go. Employer Retirement Income Security Act of 1974, ERISA. ERISA products are underwritten, okay? So because a product is underwritten, typically that's going to give you a better price. Gap insurance. Gap insurance will help eliminate or reduce your deductible. Now, here's some examples that we have right here of us using some of the pricing tools. The average cost of a colonoscopy nationwide is about $24.12, anywhere to $46.16 if you don't know where to get it. Okay, so if you're getting it at with a company like a Lab Assist or through the association network, this is what your cost will be. Using a colonoscopy assist, it's about $13.75 in this area. When I got my colonoscopy in 2022, November 15th, it was $12.75, so it went up $100. The average cost of lab work nationwide is between $25 and $125 each draw. So every time they draw that blood from you, that's what it's going to cost. Now here's a test breakdown using Lab Assist. A complete blood count with differential palette, $5.60. Comprehensive metabolic panel, $7.84. And the blood draw itself is only $7. Your total cost, $20.14. Last but not least, here we have it with an MRI. MRI averages about $1,600 to $8,400. We're using Radiology Assist, $357. And I have used, like I said, I've used Colonoscopy Assist and it works very, very well. But understanding what your costs are. Medical procedures aren't always $1 million. You just got to know where to get it and how to get it. So you have to be proactive in your healthcare costs and services. So here's some types of healthcare insurance policies. Fully funded plan. Everybody gets the same price. Doesn't matter how sick you are or how healthy you are. As long as you're the same age, you're going to get the same price. Level funded or self-insured plans. These plans are underwritten. Now, for the sake of this presentation, level and self-insured plans, we'll consider them the same because they're going to work the same for small groups. High-end indemnity plan works well with transparent pricing. I just gave you some examples of transparent pricing. In short-term policies, a term is set for the pre-X, meaning that the short-term policies last for a very short period of time, usually 3 to 4 months, and it does not cover pre-existing conditions. Fully funded plans, let me go into a little detail about those fully funded plans I just mentioned. They're most expensive without a subsidy, okay? No underwriting, rates based only on age, zip code, and tobacco use. That's the only thing that's going to differentiate the cost. Same price for healthy people or unhealthy people. Great for folks with chronic illnesses, and best to purchase on the exchange. It's best to purchase these with a subsidy. If you don't, then you're going to pay a ridiculous amount of money for them. Level funded plans. I sell a lot of these, and I'm able to sell a lot of these to individuals. So let me explain how this works. These are ERISA compliant. I just told you a minute ago what ERISA stands for. These plans are underwritten. The lower the cost for healthy groups. So if you have a healthy group, especially with young males who don't go to the doctor that much, then that's going to be where your lower costs are going to come from. They're managed by TPAs. TPA stands for third party administrators, and includes SGA, claims fund, and reinsurance. SGA is sales, general, and administrative cost. Claims fund, a claims fund to pay your bills, and reinsurance. And they're ERISA compliant, but they're also ACA compliant. So they must offer minimum value plan, and they must be MEC requirements, which is a minimum essential coverage. Level funded plan and self-insured plans. These plans are divided into 3 buckets and managed by a TPA. Bucket number 1, SGA, sales, general, administrative costs. Well, that pretty much tells you what it is right there. Usually handled by a third-party administrator. Bucket number 2, claims are paid by the employer, but managed by TPA. So stop loss and aggregate amount, the employer pays that cost. But the employer pays it based on the amount of money that he's actually contributing to the plan. And bucket number 3, reinsurance protects the employer when the claims fund is exceeded. This too is handled by TPA. So typically at the end of a year with a level funded plan, typically the employer would actually get money back, depending on how much they actually use the plan. High-end indemnity plans. High-end indemnity plans can be competitive to ACA plans if they're high-end. They pay fixed amounts just like Medicare. They're not ACA compliant. That's why you can buy them year-round. They're less expensive, potential to generate excess value. When I had my colonoscopy, I had it on a indemnity plan. I got over $1,000 back, and I had the minimum size indemnity plan. I didn't have the maximum. I've known some people to get back as much as $4,600. And best used with transparent pricing. Okay, so I think I just showed you some transparent pricing tools. So that's when you want to use these indemnity plans. When you want to be aggressive as far as managing your cost. They're available year-round because they aren't major medical plans. Only major medical plans are not available year-round. Short-term policies, temporary up to 3 months plus 1. High deductible, low premiums. Typically, the deductible can start off at $15,000, and the premium will be very, very low. But if something happens and you've got that high deductible, you've got to go through that first. No coverage for pre-existing conditions. It usually doesn't cover pre-existing conditions. And if you get cancer or something like that while you're on the product, it'll be treated for the term of the product. So at the end of that 3 months, it goes away and you can't renew the product. And ends regardless of illness status, and limited on drugs. There's a limited amount of what you can do as far as the formulary is concerned. Why costs rise each year? Aging population. We got the baby boomers. The older you are, the greater the expense. Increased demand for healthcare services. Those old people need more healthcare. Prescription drug prices, pharmacy benefit managers or PBMs. You may have heard of this before. They pretty much are poor. They can be good negotiators or poor negotiators. But a lot of times, based on the PBM, is going to be based on how much you're going to pay for your drugs. A good substitute for that PBM with that particular pharmacy is GoodRx. Increased use of medical technology and SGA in hospitals and doctors' offices. So as the cost of labor goes up in your doctor's offices, the cost of medical technology, they may come up with a new MRI machine or something of that nature. That adds to the cost of health insurance. Consolidation of healthcare facilities and profit centers led by hedge funds. This is very typical. This happened quite a bit in California. And the hedge funds consolidated a lot of the hospitals. As a result, they had a monopoly on the system, and they were able to charge exorbitant cost. Adverse selection. More sick persons are on ACA plans. That's why you see the ACA costs going up. They don't have enough healthy people on those plans. Types of insurance networks. You've got an HMO network, which is a narrow network. You need referrals, no out-of-pocket. You can't go out of network with an HMO. EPO, no referrals. In-network only, but you don't need those referrals. PPO, in and out of network, no referrals, but they're usually a little bit more expensive because you can go anywhere you want to go, and they pay doctors more. And then there's your POS, point of service. That's between a PPO and an EPO with limited out of network. So you got to network a little bit, but it's limited. How to buy health insurance. The first thing you want to do is you want to determine which type of plan is better for you. Fully funded, level funded, or high-end indemnity plan. The focus should be on the following. Focus on affordability first. You may have to get a fully funded plan if someone in your family is incredibly sick. That person and that person only should be on the fully funded plan, because it'll be difficult for them to get a level funded plan initially. Now, if they get a level funded plan and get sick, that's a different story than getting a level funded plan after they've been sick. Confirm doctors' network participation. You must make sure your doctors are in network. If you don't have a doctor, then it probably doesn't make a difference. Then you may want to use an HMO. Understand your out-of-pocket costs. You've got your deductible, your co-insurance, and your co-pays. How do those mix? Is that comfortable to you? Keep in mind, indemnity plans do not have deductibles. And do I split plans among family members? What does that mean? So you have one family member that is chronically ill. So what you want to do is you put them on the indemnity. You put them on the marketplace plan, because you know they're going to get accepted there. Give them the best possible choice you can. And you may put the rest of the family on a level funded plan or a self-insured plan or an indemnity plan to cut the cost. So your total cost of health insurance for your family has been reduced. Choosing the best plan. Who are you covering? What type of coverage matters most to you? Is kind of what I just said. Risk tolerance, low versus high deductible. For me, I can get a high deductible anytime because I know how to manage my plan properly, or I would just go with an indemnity plan. I don't have to worry about any deductibles. Confirm your provider network. Who is the provider on your network? Again, it's kind of being redundant. And split family plans, we just talked about that a little bit. Here's some legal compliance and considerations. Know your W-2 versus your 1099 rules for groups. As an example, a W-2 with Blue Cross Blue Shield, you must have 70% participation. A 1099, one for all. What I mean for that is if you give one person in the organization a 1099, you must give everybody, you must offer health insurance to all your 1099 employees, and sometimes is limited to 25% of the employees. So in other words, if you've got 4 employees, W-2s, 3 W-2s, and 1 1099, that only 1 1099 can be accepted in the group. So 8, then 2 1099s can be accepted in the group. So it gets to be kind of funny. It depends on what company you're with, though. I think that's with United Healthcare. It might not be the same with Blue Cross. And understand these acronyms right here: ERISA, Employment Retirement Income Security Act of 1974, ICHRA, Individual Coverage Health Reimbursement Arrangement, and QSEHRA or QSERA, which is a Qualified Small Employer Health Reimbursement Arrangement. Essentially, with the last two plans, what they're doing is they're giving you a set amount of money to go towards your health insurance. So everybody gets $300 to go to their health insurance, and they cap it at that amount. And then they let them go out and purchase their own insurance, maybe on the exchange or whatever. That I don't want to get into the accounting rules with this, but those two down at the bottom are written off. The one at the very bottom is only for qualified small employees, which would be 50 and under employees. The top one can be for above 50. And stay compliant if offering benefits. Tax advantage options. We got a health savings account, which is an HSA. It's tax-free savings plus investment. In other words, it's tax deferred and tax deductible. 2025 limit is $8,550 for a family and about $4,300 for an individual. Flexible spending account, FSA, use it or lose it model. 2025 limit is $3,300. You can use this money for child care. It's very similar to your HSA, but you can use it for, this can be used for child care also. And Section 125 cafeteria plans to lower your taxable income. So this is put in before you're taxed. That way you can take advantage of the tax deduction. Bundling benefits, help retain employees. Combine health, dental, vision, and life with the same company. Offer a gap policy, which will eliminate out-of-pocket expenses. It can lower your total cost of ownership. What do I mean by that? Say you get an $8,000 deductible plan that has co-pays for doctor's office visits, and then you fill that in with an $8,000 gap benefit. The total cost is going to be a lot less expensive than the total cost of, say, a $250 or $500 deductible plan. What you should do next: review your current plan and needs. Identify cost drivers. Compare plans with a broker. Schedule a one-on-one to review what you currently have or what you currently need or what you may want to get. Thank you. Again, my name is Rick Thornton with an MBA, independent health insurance educator. Phone number is up there. And I'm helping entrepreneurs protect their families and teams. Are there any questions?